The Union Health Minister, Mansukh Mandaviya, recently urged individuals who have recovered from COVID-19 not to overexert themselves. This caution comes in the wake of reports of young people experiencing fatal heart attacks during the Garba event in Gujarat, with over 10 such cases reported during Navratri. A recent study conducted by the Indian Council of Medical Research has also highlighted the potential link between COVID-19 infections and an increased risk of heart attacks. It suggests that individuals who have suffered a severe COVID-19 infection should refrain from vigorous physical activities for at least a year or two. COVID-19 is known to have adverse effects on the heart and lungs, and overexertion can strain these vital organs, hindering the recovery process. Additionally, overexertion can raise the risk of blood clots, leading doctors to advise recovering COVID-19 patients to avoid strenuous workouts, playing sports like football or basketball, and engaging in heavy weightlifting. Let us talk to Dr. Jagadeesh HV, consultant interventional cardiology at Manipal Hospital in Bengaluru, to know how to prevent heart attacks and stay healthy.
Heart attack is no longer a disease of a older generation. Of late, the incidence of heart attack is increased in the younger population. I am here to discuss the lifestyle modification that can help in reducing the incidence of heart attack in younger population. First one is the management of the traditional risk factors that can lead to heart attack, that is diabetes, hypertension and dyslipidemia. Regularly monitor your blood pressure, blood sugar and the cholesterol values. If at all any deviation or abnormality in these values, seek medical help for the management of these risk factors. Next is avoid smoking and consumption of alcohol. Consume healthy heart diet, that is low carbohydrate and fat intake, low salt and sugar intake, and increase the fruits and vegetables in your diet. Avoid sedentary lifestyle. Involve in a physical activity of minimum 30 to 45 minutes daily, and reduce the stress levels. Have adequate sleep. And lastly, those with family history of heart disease should undergo periodic cardiac evaluation to recognize the heart disease at early stage, which includes ECG, echo and TMT. Stay healthy.
Lifestyle changes and habits like smoking and drinking are some of the factors that contribute to heart attacks. It is indeed necessary to develop healthy habits, as mentioned by the doctor, to stay fit and avoid diseases. Subscribe to Daily Salar Digital for more such updates.